Hey everyone, my name is Julie and today I will tell you how to get a job in risk management in healthcare. So you might have seen my previous video about what is risk management in healthcare. If you haven't, I'll link it at the end of the video and in the description if you want to watch it after. Well, you can stay now on. You don't need that much context to be able to understand what I'm going to say. And someone asked me in the comments to share with you how to get a job in the field. So if this isn't proof that I listen to the people in the comments and that commenting works,
I don't know what is.
So I am a risk management officer in the healthcare industry. I have been for almost a year now, or maybe even a year by the time you're seeing this video. If that's the case, yay me. Happy work anniversary. And the truth is, I didn't even know risk management was a thing before I got my job. And as a matter of fact, I didn't even apply on my job, I was recruited. So basically what I'm saying is that if you didn't know what risk management was before my last video, or still is, well, you're not alone. I had no clue either. And yet, that's my job now. So when the recruiter explained the job really quickly to me and sent me the job description, I was like, well, I do want to interview for that. So today I will tell you what you need to have before applying or before getting recruited. So you know the requirements and where to find such jobs and so on. I'd like to mention once again that this could vary from a country to another, a state to another, but I do believe that generally everything is quite similar, if not the same. So let's get started. So first on the list is level of studies. So where I'm located, we need an undergraduate degree, so a bachelor's degree in the health, science, social science field. There is no specific degree you need, and you don't need to be a healthcare professional, so you don't need to be a nurse or a doctor or any of that. The main idea is that you know what's going on in a hospital and know what type of services are given in the healthcare setting. The reason why you need such degree is that you will need to analyze the impact of medications, follow-ups on mental health, plans of treatments, and so on. So that's why you do need a bit of background in the medical science, social science, fields. The reason why you don't need to be a healthcare professional is that the only time you will actually be in touch with the patient is to just talk, basically. So you don't need to have any certification to do anything. You won't practice anything on them, so you're good. And if you don't know anything in the field, it's okay. You work in an office and you have a computer in front of you, so you can always research any questions you might have on certain medications or plans of treatments or anything, or you can always ask. You're in a building full of healthcare professionals that are so kind and willing to help. So if you have a question, just reach out to the chief, who are, as I said in my previous video, your colleagues. So ask them. So now the second thing I want to talk about is years of experience. So what kind of previous work experience do you need to have to be able to get into risk management in healthcare? So in my case, where I'm from, you need years of experience in a hospital, but it can be any job. As I said, you don't need to be a healthcare professional, so you don't have to have years of experience as a nurse or a physician or anything of that. You can just have worked, as you know, in cleaning or administration or any type. The reason behind that is that basically they want you to know how it works in a hospital, what's the structure, and chances are if you were an employee, you have written incident reports before. And for those of you who don't know what incident reports are for, watch my previous videos. I talk about them and what they're used for by the risk management officer. So you will understand at least a part of the process in risk management. But there's a big but that I do have to say, and is that I'm the living example of that's not always the case. I was not a hospital employee before getting recruited. Although I had past experience in pharmacy labs and optometry clinics, so I did have a bit of understanding of patients and all of that. Oh, and I believe I forgot to mention earlier that I do have an undergraduate degree in a health-related field. I talk about my master's right now, that's in HR, so you're probably like,
what is she doing in risk management? It makes no sense what she's saying.
But I have an undergraduate degree in biomedical science. So yeah, definitely science field, health field, I got this. Now, the third thing I want to mention is where to find such jobs. So as I said, I was recruited. So how they got to me was that I sent my resume to the HR department of the hospital being like, hey, this is me. And honestly, just sent my resume, didn't say anything else. So eventually, I guess a recruiter fell on it, read my resume, and was like, oh, yeah, she fits pretty well with that job description. So she, linked us, and it worked out well, really well. So really, don't be afraid to do spontaneous applications, I guess, is that what they call it? Anyway, just send your resume, even though it's not a job posting yet or anything. Recruiters do use them a lot. And now I definitely know that as an HR management student. The next thing I would recommend is that you obviously keep your eyes peeled for job opportunities, obviously LinkedIn and Indeed and such, but I don't find that hospitals and healthcare are actually really good at social media. So I do recommend you go and check periodically on their website where they post most of their jobs. And definitely, once again, don't be discouraged by the fact that you don't fit all the criteria they want to. Again, like, I had no experience in the hospital before and I still got hired and I'm still doing a great job, so humble brag. So yeah, definitely apply, and if they really need someone, they'll get over that. The last thing I want to talk about is jobs that you can have that could help you once you'll be a risk management officer. So I mean that you don't have a job in a hospital, you don't have a job in healthcare setting, so you don't work with patients in any way, but you can get that job and it'll still help you and make you a great candidate for the risk management officer position. The number one would be accreditation. Accreditation, yeah, right. That's something I didn't mention earlier, but an aspect of my job is actually that I'm in charge of accreditation. So obviously most hospitals need to have a certain standard, and I work in creating plans and all of that to keep up our standards and still get accreditation. So whatever field you could be working in, if you are trying to keep an accreditation, keep a certain certification, well, it will help you. These skills that you will get will help you getting my job. Definitely another one could be anything in quality and safety. Again, if you watch my previous videos, like, that's the whole basis of risk management, is to keep healthcare services safe for the patients and make sure we always give quality care. So again, whatever field, if you are focusing on these two aspects, that's definitely a good side and a plus. And last but not least would be project management. Obviously, if you watch my previous video again, you know that you'll have to analyze situations and come up with recommendations, and then we need to make plans for these recommendations to be put into place. So that's very similar to creating a project and managing it to make sure it comes to an end. So wherever you're working, if you have experience or go get yourself experience in project management, that'll be a plus on your application. So here we go. These were my tips to steal my job, to get a job in risk management in healthcare. So to my previous viewer, I hope that answered your question. And to anybody else, I hope it helped you. If there's something I haven't covered or another question that you have about risk management in healthcare, leave it in the comments below and I'll be happy to answer it. So I hope you enjoyed this video. If you did, please leave a like, comment, share, subscribe.
The classic YouTube things.
So thank you so much for watching, and I hope you get your dream job in risk management. Bye!